family planning has been near and dear to many of our hearts for many, many years. And we just really wanted, Dr. Dixon called me up a month ago to tell me that he had a tale to tell about the beginnings of family planning here in Idaho, and was concerned that the story was going to get lost. And what a great way to be able to keep it for posterity and to really to help guide us and to understand, you know, where we came from and what the mission was all about. So please give me, let's all give a round of applause to Dr. Dixon. So thank you.
I'm Dr. Fritz Dixon. I was the medical director of this organization twice in past years. I came here from Cincinnati, Ohio, where I was a commissioned officer in the U.S. Public Health Service, and my kids were getting ready to go to school, and I thought it was time to kind of settle out rather than moving every year like a commissioned officer does. And so they invited me to come out here for an interview, and I came and was interviewed, and they offered me the job of medical director then of Old City County Health Department. And City County was in that two-story red brick building behind the former Thunderbird Motel down on Vista Avenue. And that's where we started, and we had one county, and then Elmore County would come in for a year, and then they'd drop out, and then they'd come in for a year, and then they'd drop out. And we finally told them either get in or get out, because we couldn't keep staffing up and staffing down and staffing up. But one of the things that we did, and I'll tell you about that, and that's why I've been invited here, was how was the first public family planning clinic in Idaho started when it was illegal. Now, those of you who are here probably don't know that at one time Idaho and many other states had a long section in their Idaho code which totally prohibited legally the transmission of any kind of family planning information, education, or services. And it was simply illegal in the state of Idaho. And anyway, I was running Old City County Health Department. And I had a lady there whose name was Elma Givert, RN, who ran the physical health side. Very competent lady, and she used to run her services, and she did it well. And she kept me posted as to what was going on, but I don't ever remember overriding one of her decisions because she was just that good. And I have to give her credit. And then we had Dr. Mary Holdren, who was a board-certified OB/GYN lady in town, very fine lady, and everybody really liked her. But Elma saw me one day and she said, I need to see you. And I said, well, okay. And she said, after work. And I thought, uh-oh, something's going to hit the fan. So I had an office, Spartan office, because that's all I needed, on the second floor of that old building. And there were wooden steps that came up. We didn't have an elevator. And I was still there then after everybody else had started leaving, and I could hear Elma coming up these hardwood steps, kind of clump, 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 clump. And I sat and waited, and she came in to my office and stood. And she said, we need something. And I said, okay. And so she went over and closed the door. Now, there's nobody in the building, and she closed the door. And I thought, oh, yeah, this is going to be a real whirlwind. But she said, we need to start a family planning clinic. And I thought about that for a moment, and I said, well, number one, we don't have any staff. Number two, we don't have any money. Number three, we don't have any place to hold it. And number four, it's illegal in Idaho. And she said, well, let's start this. She said, I have gotten enough donations of materials and supplies that we can do that. And she said, I have a place. And I said, where's the place? And she said, it's out in Garden City. And I said, well, okay. And she said, I have enough volunteers, and Dr. Mary Holdren said she will run the program from the medical side and donate her services. And I said, fine. And she said, and I said, now, it's illegal. And she had a funny smile that she used to give. And it's kind of like this. And she kind of grinned and she said, and that's your problem. And I said, okay, fine. So first thing the next morning, I called the legal department of the Department of Health. And I said, I have this problem and I want you to chew on it until I can get up there. And so I told them what the issue was that I wanted their advice on. And then we got in the car and went out to Garden City. And as we were going out there, I said, where is this place? And she said, it's in the Garden City Community Center. Well, that sounded good to me. And we got there, and there wasn't anybody there at that time, 9 o'clock or so in the morning. And she started leading me through the building. And I said, where in the building is it? And she said, in the kitchen. I said, in the kitchen. And she said, yes. So we went into and the kitchen was a big long thing in the back, and way back in one corner was obviously an examining table with a sheet over it. And so I went back and peered to see if there was anybody on the table, and there wasn't. And I said, does their board know about this? And she said, their board knows all about it, and they have voted on it, and they are completely in favor of it. And I thought, well, okay, we have staff, we have a place, we have materials, and it's illegal. So I went up to see the lawyers, and I went in and I said, okay, if I start a public family planning clinic in Idaho, do I go to jail? And these young lawyers sat there and they kind of looked at each other and they said, probably not. Well, probably is a long way from no. And so I said, okay, well, explain. And they said, there is currently in the hands of the U.S. Supreme Court a decision regarding the same kind of public family planning clinics in the state of Connecticut. And the early reverberations coming out of the Supreme Court are, and you know there's always leaks, that they're probably going to overthrow and declare the law in Connecticut illegal, which is quite similar to the one in many other states, including Idaho. And if they do that, then our law will be null and void, and it will no longer be illegal. And I said, well, okay. And at that point, we had most of them done, and we ended up starting the clinic, and it ran. But before I could do that, I had to go talk to my bosses. I'd already cleared it with the Board of Health, but I had to go talk to the county commissioners, because they were actually the bosses of the health department. But I never went to them and said, I would like to do something if it's all right. I think that shows weakness in an administrator. I went to them and I said, I'm going to do this unless you order me not to. And that was my attitude on all subjects. And so literally, and I was in hot water all the time, and I enjoyed every minute of it. But anyway, I went to a meeting of the county commissioners, led by Chairman then Leon Fairbanks, whose name ought to be immortal in this county. And I made the proposal, and then I went over against the wall and sat in a chair while they debated. And there were 3 commissioners, and they had this little hullabaloo for maybe 5 or 10 minutes, wasn't very long. And so then Leon motioned me to come over, and he said, we've discussed it and we voted, and we agree that if that's what you want to do, that's what you ought to do. And I said, well, fine. And so back then I usually wore a sport coat. And as I walked past him, though, he reached up and he got a hold of the tail of my coat, and he kind of pulled me back, and he pulled my head down a little bit, and he said, okay, Doc, but he said, married women only, okay? And I said, I'll do what I can. And that's how family planning clinics were started in Idaho. And then one day, about 4 to 6 weeks later, I had to go up to see someone up at the state, and it was on the second floor of the little office building across from the theater downtown. And as I went up the stairs and went past Jake Wyatt's office, and he had been my predecessor at the health department. And as I walked past his door, he said, "Oh," he said, "I was going to call you." He said, "I need to see you." And I said, "Okay." So I went in and sat down. And he said, "I'm filling out a questionnaire for the governor." And I said, "Okay." And he said, "There aren't any family planning clinics in Idaho, are there?" And I said, "Yes, we have one, started a month or so ago." And he said, "How could you do that? I didn't give you any money." Because their attitude then was that nobody could do anything unless the state funded it. And I ignored that, but he said, "So you have one?" I said, "Yes, out in Garden City. It's in full operation." And he said, "Oh," and he took his pencil and he erased the no and wrote, "Check yes." And that's the history of family planning in Idaho and how it was done and who all was involved. And I have to give full credit to them because it was their idea. As an administrator, my purpose was to facilitate what the staff thought they ought to do. And I agree with that, and therefore that's the end of this presentation.